Forget your warm-up.
Oh, it is.
Good morning. Good afternoon. Good evening, wherever you're at. Welcome to Procaleo. Wow, my hair looks crazy. I had this whole script of what I wanted to plan today, but I woke up with some back pain. Not severe, annoying. Never really experienced it before. So that's the moral of today. That's the story of today, I should say. And we're gonna run with it. How do we live with it? How do we assess it? How do we address it? And how do we still live our life the way we want to, even with a little bit of discomfort? Hope you learned something. All right, let's keep running.
Is there some? Is it time lapse or something?
Oh no, just photographing myself.
Oh.
I'm telling a story for my patients.
Oh. Now, are you a physician over here?
I work in Portland.
Huh?
Yeah.
And so this is sort of your way of taking the enclosed people and giving them an opportunity to see what's out?
I'd say so, yeah.
What a nice gesture.
I just still try and teach people when I
You
can't.
know, I got stuck in the hospital for 3 weeks and didn't think I was coming out alive. And
Yeah.
those little things like that open
yeah.
the world up and make us realize it's still alive.
Exactly.
Wow. Damn, people told me twice I'd never walk again.
Well,
Guess
look
who's-
at you. I see you walking around here
12
every-
miles a day.
12 miles a day. Good for you.
I've been doing that for a long, long time.
Very good for you.
But there
That's
are
awesome.
two types of people. They either want to recover and they're going to do everything they possibly can to get off of that chair, or
Preach.
they're going to sit and give up.
Preach. I had to rush home for my run because I was running late for my first peak. But when I'm driving there right now, I was thinking about my back pain, and I was thinking, why is it happening? Why did it come up out of nowhere? It's new for me. I'll walk you through a bit more when I'm in the office. And why is this person driving so slow? 36 in a 45. I'll walk you through and I'll assess my back pain together with each other when I'm in the office after these 3 patients. But I was thinking, as I'm sitting here right now, I've been driving a lot more during COVID, seeing a lot more people in their homes, patient comfort, sanitary reasons, etc., etc. And I'm thinking, if I'm spending more time in the car, that's a new thing for me. Sitting here right now, this is my average position when I'm driving. Cars driving for me, I'm paying attention. But leaned right, a little bit rotated left, just chilling. So when you have back pain or you have any sort of pain, assess when you feel it and what position is your body in when you're feeling it. And it helps answer a lot of questions. It's not this thing that just randomly comes up. It's how you're using your body determines how your body feels. So assess your body in certain positions when it hurts, like sitting. How are we sitting? Can you change it? So I feel the back pain right now. If I sit up a little taller and stop rotating to the left, I feel better. So you can always assess pain and address pain by altering your movement, altering the position that you're in. I'll walk you through a bit more what actually I feel like is going on in my back when we're in the office together. But that's just a hint for you, just a quick tip for both of us. It gives us a little bit of information to go on. See you guys soon. Time to finally go the speed limit. That was good guy, complicated case. You'll learn about him eventually. So now I'm going to 2 home visits. Update on the back, it is doing great. Movement obviously helps. The less static position, the better it feels. The more I move, the more I stress the right areas, the better it feels. That's another tip for you. Try and find positions of comfort and try and get your body moving. Your body craves stress. We'll see how my back does. It's about a 15-minute ride. It already feels significantly better than when I woke up. It's always encouraging. I bet it's hard to not know what's going on and not be able to help yourself. So that's kind of what I'm trying to do, is just give you some tips and to let you know that even us who can heal nearly anything still experience pain. Pain's a normal part of life. Living a life crippled by pain is not normal. So that's what we're trying to fix here at Procleo. What's up, dude? All right, it's good to see you.
All right, thanks, Kurt.
I will see you Wednesday. Have a good day.
Okay, buddy. Thanks for everything.
Another good session. I love my job. Back still feels fine. Did a lot of heavy hands-on work. So it's encouraging that it still feels just fine. Yeah, so now we get to go to the gym, the clinic, and let's see what's going on with this. See you there. So, open up. Welcome to the office. Get all set up, and then I'll talk to you about my back pain. So in order to first understand what's going on with your body, you have to ask the questions of, where does it hurt? What does it feel like? When does it hurt? And how does it progress when it hurts? And how does it feel better? And then you can start to get what we call a functional diagnosis that says, I have this issue when I do this. What's cool about this diagnosis is it says, improve the when you're doing this, and then your pain will improve. Diagnoses are awesome, but we need functional diagnoses to state, I'm really bad at this. Let's get better at it and I'll feel better. Cause and effect, simple as that. So, I have middle back pain, thoracic spine pain, left-sided specifically. So we look at location, left thoracic spine. There's a class going out in the gym, so I apologize probably for the bump and bass that you hear. Type. What does it feel like? It's a deep ache. That's pretty mild. I'm gonna say like a 2 out of 10. It progresses up that scale and eventually hits like a burning slash like a tingling, like ants on my back. So I'm gonna say tingling. And that's like a 5 out of 10 that progresses to like an 8 out of 10. Now, as arbitrary as those numbers are, it's relative to how your brain perceives threat, how your brain creates pain. But your numbers are important because it's relative to you. That's why they're important. They're your numbers. Because then I can start to assess, like, this isn't as bad as it used to be. But we need some objective, subjective, but objective measures to help us understand this a little bit better, which goes into the AGs and EASes. So AGs, aggravating factors. When does it hurt? Sitting, driving. Both of those are flexion tasks. So, flexion. Now, what's objective about these subjective things is the time frame. So say that I have a 2 out of 10 ache after, what was it this morning, editing that running sequence that you already watched. It's after like 20 minutes. Driving today, 35-ish minutes into work. It was not that bad because I'm able to move a little bit more. When I'm editing, I'm pretty honed in and I don't move much. So driving wasn't that bad. 35 minutes, I don't even think I felt it. But we went to Hood River this weekend, and after about an hour of driving, I felt it. And that was just this 2 out of 10. But then I was in flexion from driving to eating lunch to now, and it has been 4:43. That appointment was done. It's been like 2 hours. So 2 hours of flexion. Yes, I've been up and moving, but I'm at like the burning, tingling stage, like a 5 out of 10. We have left thoracic pain that starts as a deep ache that progresses into burning or tingling, goes from like a 2 out of 10 to an 8 out of 10 depending on duration of flexion. My body does not like flexion. Eases. Let's get out of flexion. So anything out of flexion. So we're just going to say extension, movement, change of positioning. And that's immediate. That's like immediate. Actually, let's just test. So about 20 to 30 seconds. So under a minute. So left thoracic spine pain that doesn't like flexion greater than about 30 minutes. How do we classify that then? Well, pretty much what I just said. So we have thoracic spine pain with flexion fault. Fault just means I'm not very good at it, which my body's trying to tell me. Probably we'll learn about sometime. Pain is good. Pain tells me, hey, pay attention to me. So thoracic pain with a flexion fault. Now, knowing my history, obviously I've dived into myself a lot. I know that I have mobility deficits, so I'm stiff in my thoracic spine, and a movement coordination deficit, meaning I'm not very good at using my thoracic spine. My whole life has been, if you saw my posture when I was a kid, I was here. Super flexed, yeah, that looks about right. Super flexed, cervical extension, seated lumbar flexion, standing lumbar extension, classic anterior pelvic tilt, lower cross, upper cross syndrome. If you've ever heard about any of that, if not, that's okay. I've improved it a lot. I used to have a lot of headaches. So bringing up headaches, my question is, I hit myself with a marker. My question is, why isn't it presenting as headaches? Why is it thoracic spine pain? Well, as I already alluded to, I was in the car for 4 hours on July 4th. I was trying to tire my pup out because he hates fireworks. I drove most of it. Yeah, I drove all of it, right, Lindsay? Yeah, I drove all of it. So it was more flexion. But you'd think I would wake up with a sore neck if that was the issue. So it making me think that there's some sort of rotational or side bending, so transverse or frontal plane fault. So your body moves in 3 planes, forward, backwards, side to side, twisting. So it's making me thinking that there's some transverse plane or frontal plane fault in my rib cage. Thoracic spine connects to your rib cage, which would then lead to like a functional scoliosis. So there's 2 types of scoliosis: structural, functional. Scoliosis means curvature of the spine. Structural means you're born with it, or you get it as a young kid and then your bones just developed not great. And that's the classic forward bend test that you had as a kid. Functional alludes to how your body functions, said better, how you use your body. And that's what I'm guessing I'm gonna find. I'm guessing I'm probably, based on knowing how I drive and how I edit videos, and as a right-handed person, I reach with this side more. I'm expecting to see a little bit of rotation in my thoracic spine, because I've been sitting a lot more, recording a lot more videos, editing a lot more videos, and driving longer due to home visits, as I alluded to in the car already. So that's more flexion that I'm not really thinking about it. That doesn't mean flexion's bad. That doesn't mean I should avoid flexion. That doesn't mean I need to foam roll my back. It means I need to understand, how is my back working? What positions am I putting it in? How do I train it a little bit better, just in day-to-day life? Let's go find out. Disclaimer. We all love disclaimers. There's a reason why there's not a lot of medical advice on YouTube. You go see the doctor. If you have thoracic spine pain, don't just do, honestly, don't even do what I'm saying to do. I'm just trying to retrain your brain. A smart brain leads to no pain. That's what I'm alluding to. Thoracic spine pain is hard because there's a lot of organs. There's a lot of organs that refer to the spine. The first one that you think about is the heart attack. I'm almost 30, so I'm not too young to have a heart attack. Why am I not too worried about it? Because it's non-exertional. My heart rate's not at all high. I have tested it. I have a heart rate monitor that I can test it with exercise. I actually feel a lot better when my heart rate is elevated, when my body's going. Endorphins are flowing. It's purely just postural. Static positions hurt. We'll find out why, but disclaimer, if you have any pain, let's go see the doctor. And if it's severe, especially if it's exertional, go to the ER, go to the urgent care, see your doc. Get your heart checked. But liver, stomach, kidneys, lots of stuff can send thoracic spine pain. It's probably one of the least common pain sources. Normally it's neck, normally it's lumbar spine, because thoracic spine is pretty robust. It usually doesn't hurt. But I'm not too worried about it because it purely is a cause and effect due to flexion, as we already broke down. But this is online. You're learning something, go see the doctor. I'm not liable if something bad happens, but I hope you learn something. I hope you learn to ask better questions. Even if you have knee pain, back pain, learn to ask, where does it hurt? What does it feel like? What does it progress? When does it hurt? How does it progress when it's hurting? And when does it feel better? And then start to dissect those positions. So the ags are the most important part. This music's loud, I'm sorry. The ags are the most important part because it determines what your body doesn't like doing. Get better at what it doesn't like doing, the pain will go away. Guaranteed. Absolutely. But that's the disclaimer, especially with thoracic spine pain. Just doing my diligence. All right, let's go look at it. All right, so we're gonna look at forward bend first, then we'll look at some other tests that help identify what's going on. So clear your back first. That's what you gotta do. Clear your lumbar spine. We know that's thoracic spine. We gotta clear the lumbar spine, we gotta clear the cervical spine, and then we can look at thoracic spine. Forward bend, lumbar extension, side bend, rotations, same thing for cervical spine. Let's look at all that together. Here's forward bend. I will look at it after, but you can tell me if my ribs look rotated. What you see specifically is there a hump? Honestly, kind of feels like there is. Right there. But lumbar spine feels fine. Lumbar spine feels fine. Hamstrings. Hamstrings are a little tight, no big deal. We can talk about that another time. This feels just fine. Lumbar extension. Feels just fine. Obviously a hinge, too much separation here. All these things that we can work on. Keep this tight, get more hip extension, then let it break. Feels just fine. Side bending. Either direction. Rotation. I must have spilled something at lunch. Rotation. Both feel just fine. Rotation, side bend, extension. Rotation, side bend. Closing down side, so joints are fine on the right. Rotation, side bend. It's a little harder that way. It doesn't hurt, a little harder. Let's go rotation. I'm watching myself in the monitor. That's what I'm looking at. Assessing my range of motion. That's my PT right there. Rotation, side bend, extension, stretch and obliques. No pain still. Rotation, side bend. Yeah, that's harder. I can't close down that side as much, which says it's already in a closed position, which alludes to, this doesn't matter for you, thinking in my head, which alludes to my left thoracic spine's already closed down due to being in a rotated state, which I think we probably saw on forward bend, which I'll look after. Well, I'm already here, so let's look at cervical spine. Flexion feels just fine. Side bend feels just fine. Side bend. I mean, muscles are tight and I stretch, but feels fine. I'm looking specifically for, do I have a closing angle pain? Is there a joint that's irritated that's gonna send pain into my thoracic spine? Because neck commonly refers between shoulder blades, and that's where I feel the pain. So extension. Not that great range of motion. Let's improve our range of motion. Feels just fine. Let's close it even more. Just a stretch. No pinching, no pain, thoracic spine. Just a huge SCM stretch. Otherwise, feels good. So very quick test. Have someone else test you. Have a doctor specifically test you. Neck seems fine. Lumbar spine seems fine. There appears to be a rib rotation that we will assess when I watch this footage back right now. I had this lens in the frame. I just realized it when I watched it back. I'm sorry. And you're super zoomed in because I don't feel like changing the lens. So you get a huge view of my face. Definitely lumbar forward bend. Definitely saw a right rib rotation. So if the ribs are higher, you can't see my hands. There we go. No, there we go. If the ribs are higher on one side, that alludes that rib cage is twisted higher. So when you do the forward bend test, well, I feel like I'm huge right now. When you do the forward bend test, if this rib is higher, it says that rib cage is twisted towards that direction. So my left thoracic spine is rotated a bit to the right, which closes down those joints prematurely. It gives a good idea of what's going on. That closes down those joints, closes down those ligaments, just puts that joint in an unhappy position. Like, you ever feel that crink in your neck and you wake up and it just like hurts to open it, hurts a lot to close it? means that that joint is just unhappy. The capsule, the ligaments surrounding the joint are just saying, no thanks, I don't want to move. The deep ache, I'm guessing, is a joint. Joints tend to ache. The burning, the less tingling, I'm guessing, is the muscles that are working at a higher load. If it's slightly higher on one side, that means that those muscles have a longer distance to travel. Micrometers matter in the body. That means those muscles are having to work harder to maintain that lengthened position, and that those muscles don't like to maintain lengthened positions. This is a very, very casual video. Hope you're okay with that. We're just a little bit behind the scenes of what it takes to assess and treat any sort of pain. Everything applies to every sort of pain that we've covered so far. Can I engage my abs to alter my rib position? If that's true, then Kurt needs to work on abdominals. Which also means that sitting's okay. I probably should change the way I'm driving and I'm editing videos, but more specifically, my abs need to have resting tension so that even if I hold myself in an uncomfortable position, my abs are strong enough in a resting position to not allow my body to pull it, so I get that scoliotic curve. You're great. Let's learn more. I couldn't figure out a very good angle to make that make sense, but I can actually control my left obliques to pull my ribs down, which says less foam rolling, less stretching. Those are gonna be important to make me feel better when it hurts, because that's the purpose of part 1 and 2 in our phases. Learn more about that on our website and through our books. But how do I actually get my muscles to work, to hold tension, to be more resilient in uncomfortable positions? That's the key. That's what allows us to do whatever we want to do. So that's all abs, intra-abdominal pressure, breathing and bracing, and anti-rotation exercises. That's my plan for myself, and I'll walk you through that in later videos. Big picture, I need some posterior rib displacement. I need to be able to actually do thoracic flexion without lumbar flexion, without cervical flexion, which means my rib cage needs to open up. It's a long day, long video. I hope it makes sense. Hope you enjoyed the story today. I think it goes without saying, but I'm being told that I should ask you. If you got any value out of today, please just like, comment, subscribe, share, all that jazz that I'm sure you've heard before. I would appreciate it. I'd love to create more content like this, and the more you share, the more you help me out, the more I can create, the more I can help you. So, if I feel like I've earned it, please consider subscribing. Appreciate it. Oh, and have a beautiful day.